Now we'll quickly try to establish a lecture which will give us a very clear insight into what indirect arthrography is. Arthrography is basically imaging of a joint, shoulder joint, knee joint, any joint in the body. Okay, so we have the direct one, we have the indirect. So what's the differences between the two? Okay, so arthrography, generally you should know that what it's a procedure where contrast material is what introduced into a joint. You can see that what this is the needle. So this needle is what injecting the contrast material. So when you put that contrast material, it will help you that what some components of that joint that normally they wouldn't have showed up so well, but because of the contrast they'll show well now. Okay, so it's just for detailed assessment, okay, using MRI and CT scans. So let's talk about the direct. After we're done with the direct, we'll talk about what the indirect. Direct one, we say that the contrast medium is injected directly into the joint space. This is direct. Okay, of course the other one, the contrast medium should be injected into blood, then eventually go to the joint. You understand? So you use what all those needle under fluoroscopy or ultrasound guidance so that you don't injure other parts. So you can use what the gadolinium or iodine-based. So advantages is highly accurate. You know that you're actually going into the joint space. Why if you put it indirect, you put it in the blood, you can go other places too, causing a lot of side effects. So contrast is concentrated within the joint, so to give you a clearer visualization. So how about this one? Indirect. This is a direct, directly into the joint. You can see the image is so clear around these aspects. Okay, but for the indirect, it gives you a clear image, not really clear image like the direct. You understand? So indirect one, the contrast medium is injected into the veins, so they have to cycle all around before what they get to the joint. Usually the patient even has to perform exercise. So this one is non-invasive, it's easier and quicker to perform. Okay, you just have to locate the vein. While the other one, going into the joint, you have to be very, very conscious that you're not injuring other aspects of the joints. So disadvantages is the contrast could actually go to different parts of the body, and less of it is getting to the joint. It relies on diffusion. Okay, may even miss out some details. Okay, so that's what we got.